Hello and welcome to Revitalize Portland Coalition's Revive and Thrive podcast. I'm your host, Michael Hironimus, board member here at RPC. And this episode I am so excited about. Sharon Meieran, County Commissioner, is here to answer some of the tough questions and really give us a perspective on where the county is on a lot of these issues. We'll be talking about the proposed deflection center. We'll be talking about changes to the new ambulance contract and so much more. And her willingness to get into these tough questions, really give a balanced perspective to what's going on at the city and county level is refreshing. And so I'm excited to present this interview to you. I hope you enjoy it. All right, Sharon, welcome to Revitalize Portland Coalition's Revive and Thrive podcast. So happy to have you on. I had mentioned to our leadership team that you were one of the people that I was so excited to get onto the podcast because just love your approach to how you're dealing on the county commissioner side. And you're about to leave, and we'd love to get your take on just where the county is right now in terms of a lot of these issues that everyone's so involved in. So thank you so much for being here today.
Thank you. Oh my gosh, thank you. It is really just a pleasure to be here.
Good. Well, you've been very kind and with your time and a great advocate of Revitalize Portland Coalition. In March, you were kind enough to join a panel discussion held by us and also NIAP on Oregon, talking about crime and public safety. It was a fantastic event, and it was great to get your perspective, especially from the county and also as a medical professional as well, because you've been on the streets, you've been talking with these homeless and drug addicted people, and we realized that going into that event was just having the conversation really felt like it was a therapeutic session, if you will, because we were able to get down to the nitty gritty of all of these issues that we're talking about: police, drug addiction, the justice system, where we were at. But not everyone wants to have those conversations. Do you think anything has changed since then, since that discussion? And is there more an opportunity to speak now that you're about to leave the county?
Well, I just really enjoyed that discussion as well. I do feel like it was therapeutic. That's a good description. Just kind of being there with people who actually were so engaged, so involved, and just wanting to learn, and just so thoughtful about the whole thing and smart. It was really great. And to have that city and county conversation together, I think was really beneficial as well. And it is interesting thinking 4 more months and I won't be on the board anymore. Mixed emotions about that. But I'm not sure in terms of changing, at least as to the discussion that we were having with that forum. There's been so much that has sounded good from sort of city leadership and then from county leadership, and we're all together on all these things, and then the next thing you know, suddenly the county sheriff is saying, nope, you can't, the initiative you had, and you can't, the ordinance, you can't bring people who are violating that to our jails, like out of the blue. Like where did that collaboration and coordination go? Where are those conversations happening? I talk to constituents downtown, the Pearl, and we've talked a lot about the Central Library. So after a so-called 90-day fentanyl crisis, after this newfound collaboration again, we have people just openly using drugs. There's no clear security plan. I asked our director of some of the security planning there what's going on? I'm seeing all these things. Don't we have coordination? He said, well, the city's handling that. So I don't know. I guess I'm sad in some ways that we haven't gone further, but and sadly, I'm not surprised.
Well, and I definitely want to get into the deflection center and that sort of issues with you.
I do. Can I add one quick thing though?
Of course.
So that being said, I feel like there's still sort of there's some stagnation, or maybe not the deep authenticity with leadership and that collaborative approach.
Yeah.
However, deeply feel it from many of the city councilors. I feel it from particularly Bob Day and Mike Myers and folks who have just, Commissioner Gonzalez, Commissioner Ryan, who have stood up to try to partner and coordinate with the county. And when that is not getting the results we need to see in terms of safety, they're willing to say, here's what we need to do. And it's with deflection, it's with sobering. It was amazing with the ambulance system challenges we were facing. So I think there's real collaboration there and real opportunity. It just hasn't maybe bubbled up to the top in the same way.
Yeah. And I talked about this with the hopefully future county chairs, or at least the ones that are trying to get elected, Vadim and Sam Adams. And the question to them was, there's so much there's so many people in the public space that want to maybe not help or communicate with the private space. And, the question was, the private sector has been sort of clamoring, hey, how can we help? Because we see all these things that are going on. And in a lot of ways, we know a little better how to implement these things.
Yeah.
And I asked the question, why is there a disconnect, or why is there this reticence to reach out to the private sector and try to solve these problems, jointly? Why is it? Why is that?
I honestly don't get it. I just think that there is, again, so much potential for collaboration with the private sector and so much we could do because we have issues in areas that involve sort of the very areas the private, as you said, the private sector has expertise in, experience, energy, and how could we not be leveraging in that to do so much better in terms of using our public resources? And I've seen it, I guess it's not rational to me that we're not doing that. I mean, we need just to be doing true community impact work where we are convening with the private sector, with our, developers, business partners, small business, like all the folks who kind of know how to get things done, frankly, and have the expertise and resources, and use that knowledge, use all of that to build what we need to see. I've just rejected over and over, whether it's in terms of creating a substance use disorder continuum where we can leverage service providers to provide services who really want to help. We can leverage the business folks and people who know about real estate and buy the different facilities we need, put those together, and it's like chocolate and peanut butter. We can actually reach our highest level of functioning and efficiency and cost effectiveness and vision if we do all of this together. But I hear the same thing, frankly, from a lot of the service providers that I hear from a lot in the business community saying, just private sector, listen to us. We want to help. What can we do?
Right.
And they're left out. But again, lots of potential.
And it's no secret that you have had some conflict with the county chair position, and I would say you and Julia Broom Edwards have been sort of the opposition voice, if you will. And some people see that as a personality conflict. Some see it as politics. Why do you think so much conflict has arisen on the county commissioners? And the other question is, do you think the county chair has too much power?
Oh, so I'll answer the second question first, because that's a clear yes. The county chair has essentially absolute power unless there are three commissioners who are willing to sort of tackle the status quo or challenge the county chair. She basically writes the $4 billion budget. She sets the agendas, as we've seen, for public dialogue. She moves forward with ambulances. I mean, she has been solely responsible with ambulances, with this deflection center we've heard nothing about, with the homelessness action plan, which we heard nothing about until after it was done. And that is just you don't have to use that power to that extent to consolidate it, but given that that can happen, I believe we should change our county charter, and we should change the power of the chair so that the four legislators that she is working with can use their expertise and be part of the county, sort of solving the county's problems. In terms of the first question, which was around how the question of, whether it's personality or politics, and I see a vehement disagreement about policy and how we can move forward. And I guess I see it based on my expertise in having worked in the subject matter of virtually, a lot of what the county provides. Having worked in those systems for many years, seeing where we can implement solutions and where they need to be, and seeing where a lot of this is, people's lives are being threatened, whether it's, again, ambulance response times, whether it's homelessness and public safety, whether it's addiction. All of these are so important. And what's frustrating to me is that I see a political response to something that affects people's lives every single day so profoundly. And that's the thing that I can't accept and just sit by. So I don't see it as a personality issue really. And politics, I guess it's motivational. And I do think that what I see is action from the chair's office that is it's pretty blatantly political, and I see it harming people. And we need to not do that. And we need to think rationally, and we need to address the issues we're facing with plans, with vision, with, plan before we act, identify clear outcomes and measurable goals and deliverables, and then set out the strategy to get to those. And I just see none of that happening, and it's frustrating.
Well, it's frustrating to a lot of people, especially the people that are paying the bills, which are the taxpayers. And I'm glad you brought up the ambulance situation, because there was just a recent report that came out that said that the ambulances were still running late on average. I believe it was 7 to 8 minutes late on, life-threatening emergencies. This week, a settlement was reached with AMR, the county's ambulance vendor. Have you seen the settlement? Do you think it'll make a more effective response? And what is the county doing to sort of help rectify the situation?
So the settlement, essentially, I think that there is going to be movement once the settlement actually starts taking effect. So what was at issue, it's kind of a basic math problem. We have a limited number of ambulances on our streets, and the number is limited because we have a limited number of paramedics who can staff ambulances for the advanced life support, or ALS. Portland, Multnomah County, is the only jurisdiction in the state that requires 2 paramedics to staff ambulances, and we have a national paramedic shortage, and it's really bad in Multnomah County. So we have all these requirements for paramedics. 2 paramedics have to staff ambulances, even though in every other jurisdiction it can be 1 paramedic and 1 EMT, which is a little bit lower clinical level, but still can do life-saving interventions. And because we have this rate limiting factor of not enough paramedics, experts in the field, myself, who's been an emergency physician for almost 2 decades, said, you don't need 2 paramedics to staff ambulances. Why don't we do 1 paramedic, 1 EMT? We could put more ambulances on the street and get to more people faster to save lives. This wasn't rocket science. I brought it up a year and a half ago, literally, with the chair, and she said no. And our EMS director said no. They're the only people who have said no. The situation's gotten worse and worse and worse. So the settlement agreement basically implements the plan that I suggested back a year and a half ago of doing a 1-1 model with a number of our ambulances. They haven't, we took the action yesterday at yesterday's board meeting to actually make make this happen. So they're going to start the process now. So it's no surprise nothing has really changed to now because nothing has really been done. The county's been imposing fines, which can't get blood from a stone, and that's not going to change what's happening. There are some other contract elements in there. And again, all of that could have just been handled separately all along. What can make the difference is the change in ambulance staffing, and the county delayed a year and a half to implement that. But finally, not to be I don't want to be a glass half empty person, but the glass half full aspect of this is that, okay, let's do it now,
Yeah.
move forward.
Yeah. The second best time to start is now, right?
The second best time. Yeah, I guess
the first best time was a year and a half.
a year and a, that's exactly right. The second best time is now.
Yeah. Yeah.
Yeah.
Well, speaking of now, now in the news is all of this about the new deflection center that is being proposed. The previous one being closed due to security concerns. And it's funny that we're talking about security now because supposedly the plan earmarks approximately $750,000 in the first 10 months for security. You and Julie Brim-Edwards have been vocal about the county's approach. And from what I can take, and from what the public, I believe, takes from this, is that a lot of the negotiations have been done sort of behind closed doors. It's been a very private negotiation. You have been vocal about pushing this out, saying we're not ready for this. Why are you delaying the opening of the center? And what do you think the county should be doing instead of the plan that they have put forth?
Yeah, so this is another big one. And I want to, it does seem to be myself and Julia Julia Brim-Edwards, Commissioner, who are pushing these things. And just one thing is I want to say is I am so grateful to have Commissioner Brim-Edwards as a second voice on the board who is willing to think, not be critical, but think critically about these issues. And it has made all the difference in the world just to have that second voice. The problem with this, so I don't know, I was assuming a baseline of understanding about what the deflection program is and what it's seeking to do. I don't know if we want to.
Yeah, you can discuss that. Sure. We'd love to hear your take on, exactly what the services are going to be provided.
Yeah.
Maybe that feeds into, why for the delay, right?
I think it will. So the House Bill 4002 passed back in April, in theory, to sort of try to repair some of the damage that was done as a result of Measure 110 rolling out, which decriminalized possession of small amounts of hard drugs. Time since Measure 110 rolled out, things have just gotten horribly bad. And one of the main contributors, is losing the leverage we had, the ability to leverage the criminal justice system to create change for people, to put them on a better path to get better results. House Bill 4002 was approved to say we're recriminalizing possession of these small amounts of drugs. We also encourage counties to put programs in where police can choose or give the people they might arrest the option to say, do you want jail? Do you want to go to jail, be arrested? Or do you want to get on a path to treatment and recovery? Great idea. Like that, if we had all of the resources, if our systems were functioning effectively, great idea. If we had treatment, if we had recovery, if we had all the services, if we had shelter, super. We don't have any of that. We do not have sort of the foundational structure for a system to address substance use disorder. Given that, what police, what law enforcement, communities, service providers, others have been begging for years has been a 24/7 permanent sobering center. The police or others could drop people who are intoxicated on substances off where they could sober, chill, get a sandwich, sleep, ideally get on a better path, but at the very least, be out of harm's way and keep our community safer. So that's the sort of the setting in which we find ourselves.
And free up emergency room time, right? Because
Thank
they're
you.
being dropped off at emergency rooms because first responders
You
don't know where else to take them, right?
you are doing my job for me. Thank you. Yes,
I could not do your job,
the
believe me.
ERs. So I still do shifts in the ER. And I mean, we see people who are intoxicated all the time. They do not need to be in ERs.
Yeah.
A lot of people do need to be in ERs. And so one of in places where sobering centers are done right, it's great because it deflects people from ERs, and there's a deflection from jails if people are just kind of needing to sleep it off and not be in the middle of the street or whatever. So, unfortunately, Multnomah County has chosen to be unique. A deflection center is not required by any means, certainly not by the statute, to get people on this pathway. Like, there doesn't have to be a place for people to go. But Multnomah County leadership said, we're going to open a place. We want it to be a center, and it's going to be done by September 1st, which is, just around the corner. That was not realistic. Anyone who does the work on the front line could tell you. I mean, just rational people who do real estate development, permitting, all of this could tell you that just doesn't even make sense. What are you thinking we're going to do? Instead of taking a step back, saying, it doesn't make sense, let's do an alternative, the county doubled down and said, yeah, we're going to do a deflection center. We're going to do it now. We've already leased a facility without talking to anyone on the board, without talking to the public. This is in my district. We're going to lease this place. We're going to renovate it. A place already scheduled to be demolished, has permits in the works to be demolished and build family and affordable housing, 274 units. We're going to just change that place into sort of a deflection centery thing that we don't really know exactly what we're going to do. Sort of, we don't have services for people to go to, and we're going to have very vague requirements, and we're not really sure what's going to happen. And we think there'll be sobering beds there in a year or so because everyone wants a sobering center. And here we are, 2.5 weeks to go until this thing's supposed to open with way more questions than answered. I would say it would be a disastrous security plan, but it's not even a security plan. There's no security plan.
From what I understand, it's like having mall cops there because they
That's
can't do anything. They have to call the police to come. And that's exactly
yes.
why the previous center was closed, right? Due to security concerns.
There's there were absolutely predictable security risks that will come with operating this kind of facility, except this one will be even more pronounced because the Behavioral Health Resource Center, people do just kind of show up voluntarily. Generally, if they're going, they want to be there. This is a situation where police will be bringing people, it's arrest or this place, who are intoxicated across town to a random location, happens to be, 450 feet from a preschool, drop them off. They don't have to go in. If they do go in, they come out. They don't have to be transported anywhere. No external security plan in place. And all they're saying is, yeah, we hired 2 mall cops basically to be inside the building and, in case things happen in there, I guess. I don't know. It's ludicrous. And they just released to the board the thing that they said they would release publicly a while back, but a plan for the facility. So looking through this plan, it literally tells us there's no new information, doesn't answer any of the questions people have raised, whether about security or services or anything. All it does is add like 50 pages or something, and it's filler buzzwords.
Yeah.
It's just these words that don't mean anything and little diagrams, and there's no there. So I'm really concerned right now. And so my resolution that I'd like to bring is to say, pause on opening this thing on September 1st. It can't be done. 90 days seems like the least amount of time um, in which we can open. During that time, do three things. Number one, do deflection, do mobile deflection, do the things that work. So we're not stopping deflection. So just do the alternatives. Number two, focus on the 24/7 permanent sobering center, which is actually what law enforcement and the community have demanded. Find the place, build it, and put our resources there. And then number three, think about what we're actually doing, um, and put those pieces together so that we are creating the actual structure we need to do what I think everyone wants. No one thinks necessarily the best place for people who suffer from addiction, a chronic medical illness, is jail. But
Right.
people who have this illness aren't able, it affects brain function and it affects abilities to make decisions. We
Right.
can't just decide to get off drugs. So while it's a matter of consequences, so as these things are happening, we need places for people to be safe. And if people get deflected, we need the places for them to go. Sorry that I know I can't help
No,
but speak at length, and I try really hard.
the thing that I love about you, Sharon, is you have the same sort of feelings and the same frustrations that
Oh,
a lot of us on this side of the room have. I mean,
yes,
once again, talking about
yes.
all of these things that are put in place that there's no public input whatsoever. For example,
Oh,
you're talking about the preschool that's just a few
oh,
feet away, and they're threatening to sue now because
yes,
they're
they
like,
are.
we don't want these people that are high on drugs, running around next to the children, right? And
Yeah.
it seems the same way with the county budget as well. In June they
Oh,
passed the $4 billion budget, right? Very little
yes.
input. I know it was very contentious debate, to say the least,
Yeah.
in passing that. You ended up making, I think, the quote of the year coming out of that, which we plastered all over the
Okay.
place, which was that you realize you're swimming or more accurately drowning in
Yeah.
money, and that Multnomah County has more money than they can effectively waste. And so,
Yes.
which was so well
Yes.
put, and thank you
Yeah.
for doing that. That was great. But
Yeah.
how come we can't get to? Probably know where you're going to head with this, but why can't we
Yeah.
get to a balanced budget that actually tackles and puts more funds towards these issues that we're talking about for homelessness, drug addiction, and more importantly, maybe on the other side is the mental health issue that we haven't really got
Mm.
to yet. So why can't we allocate more dollars and get more public input on that?
So
I know it's a loaded
we,
question. I'm sorry.
oh no, no, it's not loaded. It's just it's a great question. It's a deep question, and there are a number of reasons. And in terms of, I mean, that is the key question, right? And that's what I ask myself every budget process. And this one, I looked at the amount we have for the Joint Office of Homeless Services. I think it was $395 million for 1 year for the Joint Office of Homeless Services. And 250 million something of that is coming from the supportive housing services measure, where the people of Portland, Multnomah County, their have opened their hearts, have opened their wallets, have paying their taxes and saying, we believe in this. Let's make a difference. You told us if you had the money, you could do the thing. We have more money than we effectively know how to waste, and somehow we are, I guess, we're wasting it pretty effectively.
Yeah,
Although no,
seems like that.
we don't even spend it all, so we're not. But I don't know where it goes. I can't follow the money, and so I've repeatedly called for audits, both performance audits and just the financial audits,
Yeah.
to say where's $300 million going, and what are we getting for that money? Because clearly something's missing. Because we might not be able to solve homelessness with that amount. We could sure make a massive dent, and we should be able to see a tremendous difference on our streets and with what people are experiencing. And so what is the resistance to that? I honestly don't understand. And I think that's where I found myself the past, 7.5 years at the county.
Yeah.
A couple of years to think, oh, I think they're doing it somewhere. I just don't understand the county. Once I understand, I'll figure it out. Then it's like, I don't really understand it still. Maybe I'll ask the questions and suggest those things. And then that's met with just opposition and no, this is the way we do things. How dare you suggest other things?
Right.
And then it's like, okay, I'm trying to do things the right way, go through all the right channels, and I can't in good conscience sit here and watch what is happening to our county that's harming people, that's wasting money, that is having more people homeless, more people die of drug overdose, more people die on our streets, and act like that's okay.
Yeah.
And so that's why my voice, I think, has gotten louder
Yeah.
as just the problems are deeper because there is failure at the leadership level and with the county to do the right things.
Yeah. And it's disconcerting to me that
Sorry,
you're
I
one of
don't,
the leaders and you don't know where the
well,
money's going. I mean, who knows where this
yeah,
money's going? And the lack of transparency is just appalling to me.
the
These are public funds. These aren't the county's private
here,
funds.
app, no,
Helping
these,
Hands, Alan
yeah,
Evans, Bybee Lakes,
yep,
they're doing a
yep,
fantastic job, a little higher barrier
yes, they are.
shelters. And, they were having a little problems financially towards
Mm-hmm.
the end of last year. And they, up until that point, they had never taken any money from the county or city or
I
joint
know.
office of homeless services. And they had asked for some money. And it was, you say $2 million in the grand scheme of things, it's a drop in the bucket,
Yeah,
right, compared to their
yep,
budget. And they made them go through all sorts of hoops, full financial audit, which they passed with flying colors.
yep.
And because they track everything, right? They track, where people are going, how they're making it through the
Bybee
progress,
Lakes is
which
amazing.
amazing,
Yes.
amazing. So why is there not this scrutiny for the other programs that the county is dishing out money for? Because they're making Bybee Lakes go through these hoops. Why aren't they making these other programs go through these hoops?
Again, I would say the $1 million question. It's a like $395 million, $4 billion question. I actually proposed that we use funding. This was when the county was on its corrective action plan because it had not been able to spend the money it had for homeless services effectively. And then there was a whole bunch of money that came in that was unanticipated. So we had like $100 million to use just,
Right.
I think, fall of last year. It boggles the mind. What I said, let's use 10, some 10 million, whatever amount to do financial audits and performance audits of let's just start with the top 10 organizations the county does the service providers for homeless services. Let's invest in and then helping them identify what, with technical resources, what do they need to actually do what it is they're telling us they're doing. And that was voted down. And ironically, what that money was voted to support, it was $10 million to be distributed to build capacity. I'm using air quotes, build capacity in these community-based organizations. I think it was distributed to like 40 of them or something, with essentially no sidebar, no restrictions, rules, standardization. It was just sprinkled like fairy dust instead of doing something concrete that actually could have given us useful information, told us how we could improve our system, and told these organizations, helped them function more effectively and cost effectively. It is a resistance of leadership, pure and simple, and that goes back to the power of the chair. The chair gets to decide. And in the decisions, she needs the support. She needs a majority vote on the commission. And but the reality is the chair has a majority vote on the commission for pretty much anything that she puts forward. So she knows she's going to have that. So she does the bulk of the $4 billion budget. We don't even get to be part of that until it's released to the public. Then we see it, then we engage in all this stuff, and it's not transparent. And then we argue over crumbs in the budget, get our little program and say, yay, I got my project. Meanwhile, $4 billion is spent on who knows what. And that's how the process works. And that is not okay. But that is literally all down to leadership.
Or lack of.
Or some might say lack of. I will say it, or lack thereof. Yeah.
I can say it too. I'm not running for
Yeah.
anything, right? Yeah, so going along that same lines, and we're talking a lot about the drug diversions and
Yes.
homelessness because of your unique background. You've worked with them.
Yes.
You've been doing street triage. You've been out on the streets working with a lot of these people that really need a lot of help. The other issue that we've been pushing here at Revitalize Portland Coalition is the advocacy for civil compromise and diversion programs, right? King County in Seattle, Marion County here in Oregon have kind of got these, similar to a drug courts.
Yes.
The history has been there's been a pushback from law enforcement on those programs, but there seems to be maybe an open window or open door
Yeah.
with new Chief Bob Day coming back.
Yep.
Is there an opportunity to work with him to put
Oh,
the civil compromise and diversion programs into place?
gosh, having Bob Day back in that leadership role with the police is just one of the best things to have happened to Portland since, I mean, in my memory. He is such a thoughtful and brilliant leader, and he is a true partner and collaborator, and he really understands nuance. He understands the behavioral health aspects. He and I went on a trip to visit some programs, alternative programs together a few years back when we could have done something around sobering. So I think there is, yes, there is such hope with Bob Day. I think Nathan Vasquez is going to really push for some change in how we do programs. I know our mental health court judge, and I know a lot of our judges here who do specialty courts are really thoughtful and have been left out of so many of these conversations. So I think there's a real opportunity, but the county plays such a crucial role. And so we need to step up. We need the folks on the board who will lean in, have vision, try new things, and get stuff done.
Seems like if the county would just get out of the way, we might be able to do something. Actually,
I feel what's really hard for me, and it does go, I've been reflecting a lot, not deflecting, reflecting, on, yeah, I don't deflect, actually, that,
that's why
but
we love
I've
you.
been
Yeah.
reflecting a lot on just the county and its role and where things go awry, because these are the systems I live in. I get behavioral health. At the state level, at the county level, the federal level, and the ER and the hospitals, and with so many of our system providers at all levels. And so there's what I see is potential. And I've created these systems. I mean, I could share them with you. I have the maps for the systems. I have the how to get there. I have prioritized tiered strategies. And I had a plan that we put forward, a blueprint for better behavioral health for mental health systems, working with leaders of hospital systems, behavioral health systems, frontline providers, elected officials, and community leaders to say, okay, who needs to do what to get this done? We have come up with a strategy, prioritize, we need to build it now. And what would be our ideal system? And the former chair sort of deprioritized that and stopped that from happening. And the current chair did not push for it and did not prioritize it. And we don't have folks at the county who have the understanding and leadership, frankly, in our health department to implement it because they don't understand those systems. And what's frustrating to me is the discrepancy between where we are and the potential of where we can be. And it's not rocket science. It's complex and it's straightforward. And one positive thing, there's a little pour into the cup half full, is finally in my last few months at the county, the chair has finally said, that plan that you had a while back, why don't you go ahead and I'll instruct the health department director to work with you to actually pursue implementing it. Like, okay, thank you. I'm really excited about that. Not sure the remaining months I have is going to be sufficient to transform our behavioral health system, but we can get far. I mean, we don't need to number one, what I've told to the people working is like, no more meetings. We are not going to just convene for the sake of convening and engaging. We are done. We have all the information we need. We have all the money we need, frankly. And so what our job is to put the pieces together with the people who need to be at the table to actually have a product that that is something to build. And so we'll see. The county really likes its meetings a lot, which is a huge part of my
which is
frustration too.
yeah, that's
Yeah,
usually a big time waste.
yeah.
Most meetings
Meetings
I've been
about
to
having meetings, about having more
about having
meetings to
meetings. Yeah,
plan the next meeting.
right,
Yeah.
right. Yeah, I get where you're going with that.
ER doctors, that one's been really challenging for me.
Well, you're a
But
doer, not a meter. I mean, that's
I'm
what.
a doer, not a meter. I
Yeah,
like it.
yeah, yeah. I want to switch gears
Yeah.
just for a second and talk a little bit about housing. The Portland Business Journal just came out with a report that said that we're going to have the lowest amount of housing units developed and permitted since 2009, 500 units. Governor Kotek had come out with this very ambitious plan of, I believe, 36,000 units annually to try to catch up with the demand and hopefully try to curtail some of those rising housing prices as we go along. The county and the city, and there's been this public push for the housing first policy. How do you feel about the housing first policy? Have we made any strides, and what do you propose from the county level that we can sort of change this doctrine, if you will, to try to actually make a dent in the housing supply?
Okay. Yeah. There threw me an easy one there. So first of all, I just want for the record, housing first is not what I think a lot of people think it is, including the housing first proponents. Housing first is a model where for the people who are super impacted by whatever it is, whether it's drugs, whether it's mental illness, disability, whatever it may be, you figure out what is needed to meet whatever need they have, and then you match their need with the housing they need and the supportive services to help them sustain that housing. Housing retention, big part of that equation. Matching to need and identifying need in the first place, huge part of the equation. We don't do that in Multnomah County. We have like some coordinate vulnerability scale that is just so off base. It doesn't, that identifies people, places them on a pretty arbitrary list where a lot of the people who are least able to maintain housing are first on the list. They just get put into housing because all we grade on is whether we can check the box to say people have been placed. People in no way, shape, or form are ready for the housing. They can't sustain the housing. The service providers aren't providing the services needed because the county isn't asking them to or paying them to. So the people just end up trashing the place they're in or ending up back on the streets in a horrible cycle. And so to do housing first, we need, number one, to actually identify who's living unsheltered outside on our streets and what they need. That's the Built for Zero model, and the county is saying it's doing it. It is absolutely not doing it. It is a lie. It's a fidelity model. You need to do it right. And the county is not counting who's actually living outside what we need. Could we do it? Yes, easily. Absolutely. Are we? No. So we don't even know what we need or what we need to invest in for housing first. Second of all, once we identify the needs, we need to match people and then pay for the cost of the services. Super duper expensive. We don't need a huge amount of those because it's actually a small portion. In my mind, this is where the supportive housing services money was going to go, which is why we would address the biggest need we're facing, but it hasn't. So we're not using it for that. We don't identify the need and then we don't support the need. So that's why our system's getting worse. Do I support real housing first, the way it was supposed to work? I do, as a very small part of the bigger picture of homelessness. So I guess I get worried when I see, I was always the one pushing for shelter because I feel providing shelter for people is literally, because I know it is, it's a matter of life and death for people. It's health and safety for people living outside and our community. We need the shelter. We keep talking about building hundreds of units. If that, we need thousands. We have at least 6,000 people living unsheltered outside. We need both of these, and it is not an either or. It's a comprehensive, holistic plan where people who understand systems are making the decisions and who are experts are making the decisions. We have politicians making the decisions and in endless meetings with God knows how, like ridiculous amounts of money, and we're getting worse. It is not working.
And for a lot of us, this feels like the low-hanging fruit for a public-private partnership, right? Where we can.
Yes, I've talked to those partners over and over. Yeah, we can incentivize, because if the private sector is so, again, just coming full circle, private sector these are doers and they're people who want things to be better
Right.
for everyone. And we need to just truly be partners, not just in name only as it suits us.
And so this brings up the question, and I'm going to throw this at the end, sort of the ending bomb, if you
Yeah,
will,
yeah,
because in my personal experience, and we talked about this when we met at the Helping Hands event. In my experience, I've always go by the mantra: "Show me the incentives, and I'll show you the outcome." Right? And to me, I don't want to go too conspiracy theorist on you
yeah,
though,
yeah,
but this um, there seems to be a reluctance to actually solve the problem. And I start to think about all these, literally $1 billion of money that is going out the door unaccounted for, no transparency whatsoever. Somebody is getting that money, and we don't really know who it is.
yeah.
Um, it seems like the incentive is to not really solve the problem at the end of the day. And call me a conspiracy theorist, but I think there is a real homeless industrial complex where this is just, it's like being on the hamster wheel, right? We just go around and around, keep getting more money that the public puts into the coffers, and no real change is actually ever accomplished.
So I think about this a lot. Again, in my reflections back. And I feel what we do, what the county does with the nonprofits and service providers, we sort of do a Hunger Games. We throw people, we just help say we're going to give out a bunch of money, clear outcomes that mean anything, nothing that's ever followed up on. Like, there's never been a budget situation where 6 months into our budget, it's like, oh, let's report back on how things are going mid-year to ensure we're using this money like the board said we should. So it's all thrown out there, and no one is structuring things in a way to set actual holistic, meaningful goals. So I literally don't know what the chair's plan or thoughts or vision is around ending homelessness. How she puts the pieces of the puzzle together to say we have to prevent We have to shelter people and transition them if they become homeless. And then we need the housing with the right things for the people to get into. How many of these do we have? How many of this? How many of this? How much money do we have? And then put that together to say, here's what we want to achieve. Then do that next step of analysis and strategy to say, okay, what services do we actually need and what do we have so that we can effectively funnel our money where it needs to go. So we don't have the top part, we don't have the vision, we don't have the understanding of the baseline, and we don't have the goals. Then for each organization, we're not like saying, oh, you know what, outreach person, organization A, we need you to do this, but organization B, it's redundant. So we don't need to pay you a bunch of money to do the same thing. We don't do any of that. It's like we put out these bids for unclear services that aren't connected to each other, just spread the money out and expect something magical to happen. Like it's alchemy. It's not. We do not have that here. And so I'm saying I would venture to say incompetence and chaos versus sort of a conspiracy. But I don't know. I've been a little more on the 7.5 years on this board. I'm a little more into the conspiracy realm, frankly. But I'm still going to go with no strategic thinking from the leadership standpoint, understanding of our systems, or putting the pieces together to create a plan.
Okay. Well, I'm going to go with that too, since you're the one that's actually in there.
I've been watching it closely.
I think one of the biggest issues for the changeover is going to be the loss of you and your real perspective from a physician's perspective on the homeless situation and so forth. What's the future for Sharon Meieran? Are you going to do any more public service, or are you going to step back? What's your future look like?
I know it sounds just sort of not true. I literally have no idea what I'm going to do once come January 1st of 2025. I'm focusing right now like a laser on getting some stuff done because, like I said, all of the chaos has been building. I've seen it happening. We're kind of a house of cards that with the change in leadership, the house of cards, I'm like, it's going to fall down. So someone needs to be there to build it. It's crumbling down. We're seeing it, which is why we're seeing it in so many areas, but not seeing it being built back up. But there are ways to build it back up and just bring things together, whether it's ambulance services and whether it's getting the mental health structure in place, implementing the homelessness comprehensive plan, kind of looking at, there's so much work to do. I'm doing it all the time. Still doing a couple of ER shifts here and there in street medicine, but I need to do the work. I don't think I can go back to being an ER doctor. I will do some shifts always because I love the work, and seeing things in the real world actually does make a difference. As it turns out, I want to affect the change on the systems level to make those differences. And I just feel the right thing is, I don't know. The right thing is going to happen, and it's gelling. It's gelling in my mind, and we'll see what that is.
Well, we hope to keep your perspective and your pragmatic approach to these issues that we're dealing with. So we really hope that you stick around in the public light.
Thank you. Thank you so much.
Sharon, this was just a fantastic interview. Thank you so much for your thoughts, for your candor, and we really appreciate the time that you've spent with us and RPC, and also your public service. So thank you.
Thank you so much for that, and for your support, and just for your group that has done so much. I'm just grateful that you're there, and love the podcast. Great. Keep up that good work.